A lot of our patients are concerned when they have been diagnosed with degenerative discs. Dr. Schuler, what are degenerative discs, and should patients truly be concerned?
Well, degenerative disc is a term that means the disc is breaking down. And what we know is that over time, everything breaks down. In fact, just like if you had a hair that turns gray, the disc will change too. The discs are these ligamentous structures that hold the bones together and allow for motion. But as they get older, they break down, much like a rubber band. If you have a brand new rubber band, it stretches and bounces back. But as that rubber band gets old and oxidized, it's frayed, and then maybe when you stretch it, it snaps. So a degenerative disc may be a problem, it may not be a problem. It's a natural process. But if it hurts, and discs can hurt, and they're often the most common source of chronic back pain, if discs hurt, then the question is what has to be done to treat that? And that's when you got to look at the options. Is it just exercise? Is it anti-inflammatories? Are there different injections such as steroids? Or ultimately using regenerative medicine where you use your body's own healing ability? Or ultimately if surgery is needed, can the disc be replaced with an artificial disc in the neck or the low back? Or does it have to be fused? And there's many different ways. And that's what's exciting today is we can treat this so many different ways, this common condition, which rarely needs surgery, but if it does need treatment, the treatments are amazing.
A lot of patients always ask, is there a way to reverse their degenerative discs or make them healthier?
So unfortunately, we haven't figured that out. Work is being done with genomics to see is there a way to use genetics to try to reverse that, because most genetics impacts who gets degenerative discs. Yes, there's work, there's ergonomics, but genetics drives it. It's kind of like real estate, location, location, location. In medicine, it's genetics, genetics, genetics. And I think that one of the things that we can do to help people use good ergonomics, get yourself fit, work on the core strength, the flexibility, overall body coordination, emotion, but then we can take the body's ability to heal by taking the bone marrow concentrate and injecting it into the disc. It doesn't make the disc normal, but it can make it non-painful and make it function normally, which is what matters.
Are there supplements that are, or dietary changes I can make to improve the condition?
So the one thing we know is nicotine is absolutely the worst thing for the health of discs. And so avoiding nicotine is essential to optimize a healthier disc. And so that's one thing that can do. Nobody should smoke for a bunch of health reasons, but especially for the spine. In addition to that, taking appropriate nutrients. I think we all should be on a multivitamin, vitamin C, vitamin D, things that help us maintain a proper nutrient level. The issue is we don't really get a well-balanced diet every day. So it's kind of like an insurance policy. But does that change the health of the disc? We don't have the science on that yet, but it's something that I think makes common sense to optimize your chance of healing.
Thank you.